Hi guys, this is Sean from Resilient Performance and Wellness. Today I wanted to talk a little bit about knee pain and what should happen when you go get evaluation from a physical therapist or any good sports medicine person. The first thing we're going to do is check your lumbar spine, your lower back, as well as your hips and ankles. Those areas can definitely contribute, if not fully cause, knee pain. If you haven't had any trauma, for example, like an ACL tear or an actual, full force or even non-contact injury to the knee, and your pain just comes out of nowhere, we kind of wonder what might be going on upstream. So we check those things out. If those things are looking good, then we will obviously check your knee, look at all the ligaments and cartilage, and do some special tests to figure out what might be going on. So that's kind of the local evaluation part. As for me, when I was 21, I had a non-contact injury playing basketball, going full speed. Went up for a layup, planted my foot, and then tore my ACL and meniscus. So it was pretty traumatic. Ended up with 2 surgeries within the 3 months of that injury. And I've had 2 surgeries since, so 4 total surgeries in the last 20 to 22 years. So for me, there is some local damage for sure. My knee is pretty much, they tell me I need a knee replacement, right, within the next few years. So I'm not 44 yet, and I'm not really willing to accept that as my near-term future. But what we're gonna do for a couple of videos is just show you some good exercises you can do, things that I think are a couple of the best ones for the knees, and they'll also integrate the hips. And we'll kind of go through a little bit of a series of these things that basically we can put up there to help you guys out. Obviously, any of the videos that I put up, any exercises, if you have pain with those types of things, you don't want to continue and you want to get an evaluation, or you may have to just back up. I'm not going to put low-level knee exercises up, but we'll do some stuff that's a little bit higher level for more of my athletic population. So if you've had surgery recently, things like that, you're not going to go right into these more advanced things. But hopefully these will help out. And I'm doing it myself. I'm trying to prevent myself from having yet another arthroscopic surgery. So my knee is not doing too well lately, so I'm not squatting or doing lunges and things like that. I'm trying to rehab my own knee to see if I can avoid another surgery. MRI shows that I have medial lateral meniscus tears, pretty significant amount of arthritis in there. If you're familiar with articular cartilage, that is pretty well torn up, in some places 100%. So from an image standpoint, it's not a great scenario, but we know from all the research that images do not tell the whole picture. We see this in lower back cases all the time. There can be bulging discs and people may not have pain. There can be rotator cuff problems, people may not have pain. So you never want to assume because you have stuff on an image that means you instantaneously need to get surgery. You really got to get down to the root cause of what else might be going on and what you can do conservatively. And if that doesn't work, then you might look into having procedures done. But you always want to exhaust all conservative measures first, even if the injury on the MRI looks really bad. So just a few take-home points, and we're going to do a couple of videos coming up that will just have some nice exercises on there for you guys to try out. So if there's any questions, feel free to message me, email, comment, like, subscribe, share, all that good stuff. And we'll take it from there. So hopefully everybody's doing well. Thanks.